Okay, so in the beginning of today's webinar, I'm going to talk about the global market trend of telehealth, and then our guest speakers will share the use cases of telehealth in US and Qatar. Then we'll go back to talk about Advantech's telehealth solution and what we can deliver to our customers. So if you have any question, please feel free to ask in the Q&A session at the end of today's webinar. So, okay, let's start today's webinar and talk about the market trend of telehealth. So as we all know, telehealth is not a new topic, and the concept of telehealth or telemedicine can date back to the early 1940s. But recently, we have seen a strong and fast growth in telehealth market. And according to a market report, the global telehealth market size was expected to reach almost $270 billion by 2026. And the growth rate is about 24%, which apparently shows how large the telehealth market will be in the future. And there are two major market drivers for this fast-growing market. And the first one is the digital transformation in healthcare industry. And the reason for healthcare industry to digital transformation is the pressure from shortage of medical professionals. But the demand of medical care is increasing due to aging population and more patients with chronic disease. But on the other hand, for people live in rural areas, their medical demand have been underserved due to insufficient medical resources, which could hurt their quality of care and may cause more demand for healthcare services. So under this pressure, healthcare providers start to use digital technology like telehealth to enhance the efficiency of care delivery and lower the cost. So the second driver for telehealth market growth is the pandemic of COVID-19 this year. And during COVID-19 pandemic, people should avoid physical contact to reduce the risk of infection. And they also need to get their medical care without really going to hospitals. So also in many countries, under government's policy to encourage the use of telehealth, health insurance are starting to cover the payment for people who use the telehealth during COVID-19 pandemic. So I think the reason for why we need telehealth should be very clear here. It is because the diverse application of telehealth can solve lots of pain points for telehealth, for healthcare industry. So let me summarize the pain points for healthcare industry here. The first one is the shortage of medical resources in rural areas and the gap in community care, which could lead to delayed treatment or end up with a higher readmission rate. So with teleconsultation and the telemonitoring, healthcare providers can build up an integrated and seamless care for hospital to community for their patients. And then the second one is the risk of infection when medical professionals handling patients like the COVID-19 infected patients, and the short staffing in ICU and ER when treating critical cases like stroke patients. And the telehealth can help reduce the chance of contact and also help medical staff consult specialist doctors in real time to get treatment recommendation. And the last one is a more general problem in healthcare system, because there is less resources integration in a big health system, especially large hospital groups, and the limited medical education capacity. And with telehealth solution, medical professionals in a health system could be joined together, even they are in different hospitals. So next, I want to share some market statistics to explain how telehealth market expands so fast and the evidence that shows people start to adopt telehealth in their daily life. So according to a report, 50% of healthcare executives think at least a quarter of all outpatient care, preventive care, long-term care, and well-being services would move to virtual delivery by 2040. And 84% of healthcare executives think that telehealth is more important for their organization and can help improve operation efficiency. And from the patient's point of view, they also agreed that telehealth can help improve the quality of care. For example, according to a survey, 74% of patients are comfortable when communicating with their doctors using telehealth technology. And 67% of patients said that using telehealth or telemedicine services increases their satisfaction with medical care. And then in terms of insurance payments, which is one of the drivers for telehealth market I mentioned before, 91% of consumers said they would use digital health services if the cost was covered by insurance. So I think here we can see that telehealth is a promising market, and especially during the pandemic of COVID-19, since people should avoid close physical contact to reduce the risk of infection. So telehealth allows symptomatic patients to access doctors for disease consultation or treatment recommendation when they still stay at home. And hospitals is adopting telehealth solutions to treat quarantined patients without going to isolation ward, and which can protect healthcare professionals and reduce possible exposure to infection. And also, telehealth is extensively used in early screening for patients triage before they arrive to hospitals. But however, there are still some challenges. For example, many hospitals are still facing insufficient infrastructure to implement telehealth, like hardware, right technology. And some hospitals even struggle with the reliable networking infrastructure like broadband, 4G or Wi-Fi, and this could largely limit the connectivity within facilities or to the new area of care. And on the other hand, for users, because telehealth is still a new technology for most people, there is a learning curve to using telehealth in traditional healthcare providers and the patient's relationship. So learning to use different tools, online scheduling for virtual visit is somehow difficult for these users. And in addition, the key factor to COVID-19 pandemic management is testing and identify who is infected. And this is not a conventional telemedicine today can offer. So, however, we are still confident that telehealth is becoming the new normal or the new paradigm in healthcare, even after the COVID-19 pandemic. I would say telehealth is here to stay. And according to a survey this year, among 1,300 physicians, 90% were using at least some form of telehealth, and 60% were planning to continue this practice afterwards. And it is interesting and surprising that 3/4 of patients accessed their first ever telehealth visit during the first wave of the COVID-19 pandemic, and most of them reported high satisfaction with that experience. So where can or where should telehealth solution be applied to, and what is exactly the telehealth application? I would say teleconsultation would be one of the most promising telehealth application, which can help save lots of time due to waiting in clinics or traveling to hospitals. And doctors can also give their recommendation and diagnosis in real time, no matter where they are. And this is important for patient treatment, especially for those critical cases like stroke and myocardial infarction. For this critical disease, time is everything. So teleconsultation will be very helpful. And then the other application is telemonitoring, which focuses on remote patient monitoring for recording daily vital signs like blood pressure, heart rate, blood sugar, and other indicators like what you eat, exercise, and sleep time. And this could help patients and doctors better manage the chronic disease like diabetes or the follow-up for post-acute care. And the telehealth solution can fit in different health care settings like hospitals, primary care, skilled nursing facilities, community health centers, and public agencies. And it also can be used in school, rural area, cruise ships, and ocean shipping. So I would say basically with the right tools in hand, telehealth could be used in any place where network connectivity is available. So, okay, so after the part of overall market trend of telehealth, let's welcome today's first guest speaker, Penny. And Penny is the product director in VC, which is the leading telehealth software company in the US. And today she will share the telehealth use cases in the US. And please enjoy this talk. Okay, let's welcome Penny.
Cool. Thank you, Junkai. Can you guys hear me fine?
Yeah.
Okay, cool. Yeah, so hi everyone. My name is Penny, and I'm the director of product from VC. So before I start, I would just like to share with you guys some of the insights to the numbers of telehealth visits claims that's being submitted in the US since the start of the COVID pandemic. As you can see, the numbers pretty much went through the roof since mid-March, for example. And a lot of our customers are actually using telehealth to deliver care to patients, and they actually offer like counseling therapy, speech therapy, urgent care, remote patient monitoring, and stuff like that. So each specialty or like each provider, they actually have to work through their own workflow and also their use cases to make sure that technology is actually helping them to deliver care and not a blocker for them. So like over the last few months, we have actually worked with like a lot of new providers that have never used computers to talk to their patients before. It's actually kind of nice to see, like it becoming like a more mainstream thing where the doctors are able to, see the patients from their home. So we have got a doctor who is like an OBGYN. She got COVID herself, but she had to see her patients who are pregnant, but then because she couldn't actually be in the office because she didn't want to spread the virus. So she has been working like day and night, like even when she couldn't breathe and all that. And she was still trying to care for the patient, and she was just really thankful for technology to be able to step up to do that. So the next slide is, so we have, so Junka, are you going to be, here. So this is just a list of customers that we serve in the US, ranging from Optum to Walgreens to DaVita, International SOS, GE, and so on. And in the next slide, so this is a special customer of ours. So NASA actually used VC during the SpaceX Dragon docking with ISS mission recently. And as you can see in the picture here, so the astronauts on the International Space Shuttle, they were using VC to follow the journey of SpaceX Dragon, so they know that like where are they in the journey, because they had to prepare for the docking. So it was actually really nice to be able to see that being demonstrated in a documentary that NASA just released recently. So NASA is going to have a moon mission coming up in a few years. So we have been talking to them last, in the last month to allow the astronauts to see that, talk to their doctors or physicians from the space using BC when they go to the moon in a few years. So the next slide, please. So today I'm going to talk a bit about what we do as a company and also some of the deployments that we have done in the US or in some other parts of the world. So there are actually quite many video solutions out there in the market today, but we are probably the only one that is healthcare centric. And what I mean by that is that our video stack can allow you to stream the images directly from devices like an ultrasound or iriscope or dermatoscope, for example. And it can also allow the doctor to do pan tilt zoom on the camera so that the doctor can remotely, check on the patient's faces and all that. So we, if you go to the next slide, please. So if you, so basically we think of ourselves as the Home Depot of telehealth. We don't think about telehealth just as a video call or a video consult where the doctor talks to the patient on the phone or using video on the computer, right? So we think about it, from the whole workflow perspective and the continuum of care. So, basically we're trying to make sure that the workflow it works, from before the time that the patient enters the waiting room, all the steps that they have to do insurance verification, to do payment online, to schedule an appointment and all that. So these are the parts and pieces that we have on our platform that we would actually work with our customers to kind of figure out what their workflow is, and we'll just pick and choose the pieces and rearrange them to fit their workflow. So if you go to the next slide. Yeah, so patients often spend a lot of time on the non-video related stuff, like setting up the audio and video, making sure the network works, checking on the insurance, filling up pre-visit form, making sure all their details are correct. So what we recommend our customers in the most cases is that we recommend them to have a medical aid to make sure that all the patients are well set before they hand the patient over to the doctor, because more often than not the actual video consultation with a doctor, it can last as short as 7 to 10 minutes, for example. So in some of our past deployments, we find that, some of the doctors, they would end up, spending the time waiting for a patient's scheduled appointment, but then the patient would end up not showing up. So that would actually be a lost cause for the patient, and it would add up to be quite costly to the hospitals. So in a typical workflow that we actually recommend to our customers, depending on the size of the practice as well, having a front office medical aides or medical assistant, to be able to make sure that everything is set, and the doctor can then be focused on seeing the patient one after another, and that would actually increase the efficiency for the entire practice by quite a bit. And then next one. So this is, so I'm going to talk about this is the first use case I'm going to talk about, which is the remote patient monitoring. So there are a couple of cases that, that we have deployed this model in the US. So the first one is that a hospital can actually dispatch a nurse to the patient home itself to collect the data or the vitals from the patients. And the doctors can then be monitoring, the patient's vitals from the dashboard, on the dashboard, from the hospital itself, without having to travel to different homes. So if, let's say, the doctor, can see some data that is not very nice, is alarming, that the doctor needs to intervene, the doctor can pull up the patient profile and then look at the trend lines either by the week or by the month. So we have also deployed like a population care kind of dashboard to some facilities where like they are caring for a diabetic population, for example, or a pre-diabetic population. So what they would do is they would actually send like a kit that has a couple of devices for each patient. So the patient will be at home, and then whenever the patient is taking some readings, for example, some measurements like a glucose reading or like a blood pressure or their weight. So whenever they do that, the data will be synchronized to the platform automatically, and the doctors and the care team at the hospital, they will be able to monitor it. And then if they need to reach out to the patient and say, and check in on them, say like, hey, how is it going? What are you doing? Your blood pressure is quite high right now. If they need to just send a note to the patient, they can do that immediately, and the patient will be notified on their mobile app. So in this model, we find that the hospitals are able to decrease the cost by quite a bit, by having, like let's say a team of say like 10 nurses, and they are able to manage quite a large population of the patients, because they don't have to be looking at each patient's vitals individually, but then they just have to pick out like which are the numbers which are slightly out of range or which are dangerous, which are whatever, and those are the patients that they would be spending more time and escalating them to like a second tier care team, for example. And the next one. Yeah, so the next one is like a digital quarantine room that's being developed fairly recently with COVID and all that. So this is a setup that can be done in an airport or like any facility where you need to hold a patient, like have them be quarantined at a facility before they are being transferred to the hospital. So the setup is that you can have a PTZ camera within the room, and then you can have some devices in the room, and the doctor or the nurses can be, remotely controlling the camera to look at the patient's features, or like, the faces, the expressions on the face, and they can zoom in to look at their eyes and all that. And at the same time, they can also be collecting data remotely, because the devices, which will be wirelessly connected to the platform, are in the room itself. So it really, like, so the size of the room, it really depends on like, the use case that we're looking at, and also like, the facility that you have, and the devices, those are the things that you can, pick and choose depending on like, what kind of like patients you are caring for. So, and then the next one. Yeah. So, we've actually done work in quite many different settings. So this is an example of, our work in a refugee camp in Iraq. So I traveled with a team of about like 12 to 15 doctors or surgeons to Iraq. And what we did there was that, because the network condition was actually pretty challenging, but we're able to connect to a specialist in the US in this case. So in the picture on the left, we were able to do a live consult with an ophthalmologist in the US, and you can see that, like we are live streaming the images of the iris of the patient through the iriscope, and the doctor the doctor in the US was able to do like to diagnose the patient, and he actually found that there's a tumor on this kid's eye, and he was able to like recommend like a plan of action immediately to the doctor. And in this case, we actually were able to save the patient's life, and like save the patient's eye, without having to, wait for it to deteriorate and all that. So, and the picture on the right is where we actually turned a surgery room into like a teaching surgery room, where like, we were able to allow 10 other doctors to be watching the surgery, that's happening in the OR, and because the OR was so small and we couldn't fit all the doctors inside. And when the American surgeon was doing the surgery, he wanted to be able to like talk about the steps that he's doing, to teach the local doctors and say, this is what I'm doing, why am I taking these steps and all that. So the other surgeons or doctors are able to participate remotely from like another auditorium that's like, in a different building. Yeah, so the next slide. And so this is our partnership with Advantech. We have actually deployed the Advantech's cards, Amis cards to, like quite a few hospitals in the US and also in Qatar. So like Swati from our Qatari partner, she will talk a lot more about the Qatari deployments later on, but I'm going to talk more about the deployment that we have done in the American hospitals. So we did this with a partner called MedNext, and they're like a OBGYN staffing company. So they staff a lot of the hospitals, and they actually focus on maternal fetal medicine. So when they got the cards from us, what they would do is they would actually be connecting the like the specialist or OBGYN with the patients which are in different hospitals. So because on the cards there are actually the pan-tilt zoom cameras, the USB ultrasound probe, they have the stethoscope, they have the all-in-one scope and all that. So the nurse would be pushing the card into the patient room or Nicu, for example, and then as the nurse was doing the ultrasound scan on the patient, the doctor will be able to see the live image of the scan, and then the doctor will be able to be like, hey, like, stop at this position, zoom in, like get the measurement and all that. So these are the things that like a specialist doctor can do whilst being in a completely different building, or like the doctor could be at a home or like at a different hospital, and the doctor is able to care for a larger group of patients, but they're scattered, around like different places, different, in the geography area. So what MedNext has done is that they're able to save costs by, like having the same group of doctor to cover a wider area of patients. So this is an ongoing case, and the need for this kind of like doing remote exam on the patient has actually risen a lot, especially since the COVID pandemic. So yeah, and I think like Swati has a lot more to share about how this is being used in Qatar to deliver care to the patient, and I'll hand it over to Swati later on. And yeah, if you guys have any other questions, feel free to let us know later on, and I'll be happy to discuss further with you guys. Thank you.
Okay, thanks for panel sharing. Then let's welcome today's second speaker, Swati, to share the case, the telehealth use cases from Qatar.
Sure. Thank you, Shankai, and thank you, Penny, for the details. As introduced by Advantech, my name is Swati. I handle the healthcare projects in Qatar. So first, I'll just give you the little insight how the Qatar is and what kind of healthcare facilities Qatar provides. So Qatar is a very small country. However, I would say far ahead in terms of providing the healthcare to their expats and to their own citizens. That is the, I would say, the entire population. So Qatar has one big, huge corporation, which is called as Hamad Medical Corporation. And they are the leading public healthcare provider in the state of Qatar. So they take care of 13 tertiary hospitals, 23 primary healthcare centers. They run the national ambulance along with home healthcare services. So I would say they dominate 95% of the Qatar market. And I would say its HMC is formally recognized by the JCI as the first healthcare in, I would say, globally to have JCI accreditation in all of its 13 hospitals with the gold standards. So it's one of its kind in the entire world, I would say, with high standards of care given to the patients. Now, coming back to the telemedicine. So Hamad has a stroke department which was established in 2014 and has been again aggregated twice since now for their high standards of quality care. So we started this program of telemedicine back in 2016, wherein we were using off-the-shelf video conferencing technology to fit the medical emergencies. So it was, I would say, a makeshift solution wherein the patient was taken care. However, the vision was far ahead to achieve. Like we wanted to integrate the medical devices as well. We wanted the security level as well. So that's the reason we partnered with VC. I guess Penny has already given the insight of the VC, how secure and how agile and how good the VC platform is. So VC is it's HIPAA compliant. It works on the lowest bandwidth. We can integrate the medical devices, and you can. I mean, it has a lot of features like you can text, video, chat, collaborate, share the screen. You can collaborate with your patients. You can collaborate with your internal staffs to discuss any cases, and also you can connect. I mean, this is one of the use case which we would like to do. It's while connecting through satellite. I mean, and doing the air ambulance. So this is one of the use case which we would like to do in future. So coming back to stroke. Yeah, so this is a stroke unit wherein HMC has adopted the hub and spoke model, wherein this is the stroke unit is the hub, and we have connected till now 3 hospitals using the telemedicine solution. And the vision is to connect pending hospitals and also the primary healthcare centers. We are using Advantech medical cards. I will request to go to next screen. Yeah, so this is the Advantech medical card, and we are using a PTZ camera with Jabra speakers and VC collaboration tool on the cards to connect to the patients. These cards are used everywhere in Hamad Medical Corporation. We are using in ICU, we are using in NICU, we are using in normal wards, outpatient, inpatients. So using VC on the card was very easy, I would say, or very adaptive, because the nurses and the physicians were already using the cards. So it wasn't a new technology for them. It's just using VC with the PTZ camera, and we were able to treat the patients. And the function of the PTZ, one of the important function is that the remote user can control the camera and can diagnose the patient. That added the benefit to the stroke, and the success rate of stroke in treating the patient is 68%, which is very high because the global benchmark is up to 50 to 60%. So I would say when telemedicine came into picture, we were able to, I would say, treat the patient within 1 hour. That saved the patient's life, expedited the recovery of the patient. So that led to the higher percentage of the patient recovery. So it was really added advantage to the stroke unit. And looking at the stroke unit use case, there were other departments, they wanted to adapt the same technology and the same platform. So the second use case we have is for the NICU. Can we go to the next slide, please? Yeah. So the second case is we have Pediatric Emergency Center, and we were planning to connect the NICU, which is Al Wakra one site, and then Sidra is another site, and there's one more site which is WWRC. They have the NICU there as well. So the head is to sit in the PEC, and if there is any emergency, generally the doctors is to call on phone and do the consultation over the phone. And when they wanted to see the video or the readings of echo machine, it used to be done on WhatsApp or any kind of other methods, which was not secured and safe. And I would say was not even accurate, because it was kind of a guesswork to do the diagnosis, which again endangers the patient's life. So this is the reason we did I would say experiment wherein we tried to live stream the ultrasound machine, and it was a huge success. So now using the Advantech medical cart VC as a collaboration tool, we can live stream the ultrasound images or the echo images from one site to another site. And the head or the other physician on the other side can easily see the patient, easily see the EMR, can see the readings, and can take a call then and there. So this expedites the patient care, enhances the quality that we are giving to the patients. And I would say, hello, can you hear me? Hello?
Yeah, we can still hear you.
Okay, great. So it gives the quality care. So the vision which we have, the Hamad Medical Corporation or the government has to give a high standard of medical care, I would say telemedicine will contribute to some extent. Because going forward, the vision is to integrate medical devices like patient monitoring devices. We have already successfully done the ultrasound. We would like to test patient monitoring devices, remote monitoring devices like glucose machine or oximeters and other devices. Also, we would like to do it for the mental patients, mental health services, and for the rehabilitation centers, wherein they can just look at the patient and do the consultation. At the same time, they can check their basic readings. So during the pandemic, which is the COVID-19, I would say people really understood the value of telemedicine. I mean, how useful it is and how it can still cater the patient needs sitting at home. During the quarantine, I mean, during the pandemic, we have deployed Advantech medical cards with VC and PTZ, the same setup in the quarantine centers, wherein the doctors had not to go to the room. They can sit outside at the nursing station and can see the patient and do the diagnosis. So this reduced the rate of infection because during pandemic, I would say 38% of the healthcare workers were infected while treating the patients. So this reduced the rate of infection. There was social distancing. We still did the patient care, and patient was, I would say, somewhere safe and sound. That fine, somebody's taking care of me. Also, we connected the remote patient monitoring devices wherein we can continuously monitor the patient's temperature and everything. And in case anything alarming, then yes, we used to go to the room and they used to check. So this was the use case for the quarantine center. And with the Advantech medical cards, Advantech cards are medical grade. So it was easier for us to use those cards because you can easily clean it with the alcohol. So I would say the entire setup was really useful for us to fight the pandemic or to treat the patients in the quarantine centers, I would say. And going forward, so Qatar is Hamad Medical Corporation especially is more into innovation projects. They really like to experiment with the new technologies, and they would really love to adapt the new technologies which is available globally. So going forward, yes, we would like to continue this engagement and we would like to adapt new technologies which helps in the patient care. That is the vision of the Qatar.
Okay. So thanks for Swati's sharing. And okay, now I'm going to back to talk about Adventist telehealth solution. Okay, so at the beginning of this year, Advantech started working on building a telehealth total solution for our customers that combined a mobile workstation, which could be a telemedicine card or a portable suitcase, and a video conferencing software VC, and the digital extended devices horoscope, and we are developing a teleconsultation software, and we hope this ready-to-use total solution for our customers, and it can help our customers to build their virtual clinic very easily. And so for the telemedicine card MS72, this is a medical-grade mobile workstation that fits a medical environment and is very convenient for medical professionals to use. And it integrates a medical computer and high quality PTZ camera and speaker phone. So it is very pretty good for video conferencing, and video conferencing is the core of telehealth application. And then we also provide AMIS 22, which is carry on-site suitcase and is portable for on-site use like home visit. And this suitcase features anti-collision and waterproof, and it has a medical tablet and a high-quality speakerphone inside, so which it can support video conferencing. And then, yeah, we also have a medical communication software, VC. We already introduced this software. And then, so most important part is that this software is HIPAA compliant, and which can prevent data leakage, including chat records, video and audio transmission, and data storage, which is very safe for patients and doctors to use. And besides, we also have high quality digital exam scope, horoscope. We integrate this device into our telehealth solution because we think to give a diagnosis with appropriate patient examination remotely is also important for telehealth. So you can see this is this has one control unit with 3 lens that is replaceable, and the 3 lens is used for the first one is general scope, and otoscope and dermatoscope, and this device can be used for specialties like ENT and dermatology. So medical professionals can use this horoscope to do patients' examination, and the images are transmitted to remote doctors in real time. So remote doctors can give diagnosis with reading these medical images. And then we also have a teleconsultation software, which is in development now. And this software is for clinical workflow during a teleconsult or a virtual visit, which features patient list management, virtual clinic management, and they are very necessary before patient visit. And it also features visit record management and cloud-based data management. They are very important after patient visit. So there are 3 application scenarios for our telehealth solution, and the first one is I think everyone is very familiar. The first one is teleconsult, and in this application, our solution can help medical resources to be uncentralized by connecting doctors in medical centers with the patients in a rural area, and it can solve problems like shortage of specialist doctors in rural areas, or delayed treatment due to the time and the traveling cost on going to cities for medical care. And the second application is for handling critical patients in emergency room and ICU. And the telehealth solution can fill the gap of staffing in ER and ICU by connect specialist doctors in real time. And the last one is in isolation ward. With telehealth solution, medical staff can reduce the chance of entering isolation ward, but still can communicate with isolated patients through video conferencing and check patients' condition, which reduce medical professionals' exposure to infected patients and lower the risk of infection. And now we are testing our solution in Taiwan. In the northern part of Taiwan, the rural public health centers suffers from lack of specialist doctors for dermatology and ophthalmology. Unfortunately, most people live in this area are elder people. It's very convenient for them to take a long trip to see doctors in the cities, especially for those people with diabetes. This inconvenience could stop them from doing routine fundus examination, which is very important for diabetes management and early prevention from retinopathy. So with our telehealth solution, rural health centers are connected with medical centers to get teleconsultation for dermatology and ophthalmology. And another teleconsultation use case is in the middle of Taiwan. And they connected a community clinic in a mountain area with the medical center for teleconsultation of ENT and the dermatology. So we put our telemedicine card and a horoscope in community clinic, which is the patient site. And the doctors at the patient site carry out the examination, and the remote doctor site can give treatment recommendation in real time. And our telehealth solution can save patients a lot of time and cost spent on the long trip. As you can see, it's about a 60-minute trip, and from the mountain area they live to the medical center. So that takes about 60 minutes. So remote care is efficient without compromising the quality of the care. And besides, remote doctors can see patients very clear through high quality conferencing, and the images captured with horoscope can be transmitted in real time to the remote doctor site. And also, because the software features screening sharing and remote annotation, so these two functions can help remote doctors to communicate with patient site's doctor and the patient. So you can see in this picture, remote doctor mark the image of skin lesion with different colors. So you can see the green circle and the red circles on the images. So remote doctor use these different mark to explain where to apply medicine and where should be protected from further inflammatory reaction. So this is our telehealth solution be used in Taiwan. And this slide shows Advantech's mission, and we have been working hard on telehealth to increase the quality of care. So we hope telehealth solution can be promoted to the world. And so that's all for my sharing today. And thank you. So, okay. So today we have talked about the telehealth market trend, use cases, and Advantech telehealth solution. Now it's the Q&A session. So please feel free to ask questions. Any questions? If you also, you can leave your question in the chat room if you are shy to talk.
There's a question in the chat about the regulations and standard of medical practice. I guess.
Yes.
Yeah.
Okay, Penny, you go first.
Yeah, so it depends on the country. Like, is there a specific country that you were interested in finding out about, or it's in general? Because like in the US, for example, they are actually getting stricter and stricter over time. But the government actually had to loosen, like the whole compliance thing because of COVID. Because not every, like, so previously the doctors would actually be fined for using like FaceTime, for example, to talk to their patients. But because not every doctor was not all the doctors were equipped with the tools to see patients online in a HIPAA compliant way. So the government actually had to, like loosen it for, during this time because of COVID. So they may change again. So in the US, like things are actually changing very rapidly. over time. But in general, like, so most of the telehealth systems out there, they will tell you that you know, they're HIPAA compliant or like high trust compliant or SOC 2 compliant. I can type it in the chat later on, and you guys can read up more about it. Basically, it just talks about like how like the software companies are dealing with the data, and you know, like only people who need to look at the data, they can review the data. Not everyone have access to the data and stuff like that. So yeah, I mean, if you have more specific questions, you know, like I hope that answers your question.
Okay, there is a question about, has Advantech other medical devices such as ECG, which can be connected to MS-22 or MS-72? Okay, now we only integrate the horoscope into our solution, and that is the tested and okay, ready to use. But we also consider to integrate more medical devices like ECG or vital signs, or the other devices into our solution in the future. But now we just have the horoscope now. And sorry, there is also a question that does Advantech have complete solution including software? As I mentioned before, now we have a total solution that combines hardware and software, and the software is VC Messenger now, and we are developing teleconsult software, but just in development now. So in our solution, we only have VC as the software can be used. And there's a question, can the software pull patient data out of his system? Is this question for Advantech or VC, or is for me? I think so. Well, now our solution is not ready to integrate with his system, so it's independent system that apart from his. Yeah.
Yeah, so I guess for Edgar, it depends on like which country you're in, because like in the US, for example, the EMR systems like Cerner, Epic, they store the patient data in a pretty standard format, which is HR7. So basically, like, you know, if you have the converter, you know, that can actually pull the data. Like, so basically, like Cerner, for example, you have to get a third party software to be able to integrate with a third party software. So these can be done, but if you're talking about like some other countries HIS system, we'll have to look into, you know, like what is the framework that they have? Is there any API interface that will allow you to request or like push data back and forth between two systems?
And just to add to this, it depends on the workflow as well. What kind of workflow they want to do, what kind of data they want to pull. So in Qatar, the plan is to integrate with the EMR. We have Cerner as EMR, standardized. Every department has a specific, you know, information they want to pull through HIS. So it totally depends on the hospital and then kind of workflow they want to go for.
Yeah, so some of customers, they actually do the integration. Some of them they prefer, like the doctors prefer to operate using two separate systems, because for the most part, they actually think that HIS or EMR, they are very bulky, very heavy, and it's hard to, there's so much data in there, and they don't really need most of the data to talk to the patient. Yeah. So in, like, we actually have a lot of our customers, they actually prefer using the more lightweight, or like more like the quicker to response software, and not doing the complete integration with the EMR. But if you're talking about like insurance, you want to do insurance claims in the US, then you have to be able to push some data back to the EMR. So that's a completely different thing. So yeah, it depends on the country again.
Okay. Although there are still some questions left, but I think we can stop here, and the response to the question left will be sent by email. So, okay, I think it's let's thank our guest speakers, Penny and Swati, and that's all for today's webinar. And then I hope you guys have a great time. Thank you. Okay, bye.
Thanks, guys. Bye.
Thank you all. Take care. Stay safe.